We're in.
Right. Nice. Have fun.
Thank
I'll be back
you.
to take photos.
Hi Joe,
Hi.
สองสบาย
Was it good? Bye.
ร้องไหม
Okay.
Joe, this discussion I will share, I will send to you or what? Okay. Who organize it?
What are the names?
นี่เนี่ย so that we can connect it out. Joe เราถึงห้างได้ Joe สองห้าง
Where did you have the laptop? You want it here? I think so, right? Yeah. So it's like a, yeah. And they're going to cover like this. Yeah, so maybe like here? Yeah. Okay. Okay. So the live stream is not on the Huba app, but it is running, so make sure everything is good.
Actually wondering, like, maybe that's needed for every function we have to have a picture.
Yeah.
Six this like
Yeah.
all the scenes. Oh. Should I turn this on?
Yeah, that's true. There are extra microphones in each one. Just, I think these two seem louder than that one to me. So just pull that down until it lights up.
Hello.
Like this. Okay. So cool. So do we have to turn this on as well?
Mic test.
So does it seem we have to advance it there.
Oh, so we have to like pull it here. It's very different when it's on TV and then it's on this way because this looks so nice
Yeah.
on clear. This is the 50 million that everyone is using.
Yes.
And they're going to be asking, is that accurate?
Locally, our local task force coalition, whatever, the only thing people will ask is like, what's the prevalence in Orange County? How would anybody know that? Like any number we could give would be, you know,
Patience of the mind.
I would be happy to give a number,
But it can't. Oh yeah. So we have to like do this like from here.
Mm-hmm.
Alright.
But if you want me me to advance it while you're talking, I'm happy to, or if you want to do it.
Is that the loud one? I moved the.
I think the two orange ones.
Oh, that's for one. It's a manual, right?
Do they have
I think the other ones. The
Okay.
movement, the coalition
Oh, yeah.
conversation. There's like 3 people, 4.
Yeah.
Did you join the 2 to 3 something earlier?
I did now. I went to the change.
Oh, you had another.
The one that was in here.
Ah, no, they have the breakout like a 2 to 3.
Oh, I didn't go to that one. Did you?
I was like wondering what was like the global something.
Yeah, I wasn't sure what it would be, and so I thought I'll just use more time.
Yeah, and I was also wondering why is Vietnam not there?
Oh yeah.
It's like
Yeah,
Blue
are
Dragon.
there not enough people? Or?
Maybe it's just Blue Dragon. They just put like global or
Yeah, I guess
plus.
I haven't seen anybody else.
Maybe it's just maybe is it true? Like she said, like it's just them that really works and saver.
That's what the British Embassy said.
Yeah, so it's pretty much it. Like if the population is gonna be like doing like direct line, right? That's it. But the British Embassy also said last time they tend to like work on their own private like what is that like they tend to like just do things like on their own.
Blue Dragon.
Yeah.
That was so when I was in the UK when I met Vietnam the first time, there was somebody from Iowa, Vietnam there, and she was like, "You have to use this to the government would never allow it," and I was like, "Oh, we're about to go." So
Really? The one from Iowa is that one?
but I was like,
Because what Caitlin said, we don't have, there's no like coalition, like that where the province and the government like join
Yeah.
us together, but they have like on their own like
Right.
coalition and they separately work with the government.
yeah,
I was like wondering like the whole Blue Dragon, like they have registration in New Zealand, Australia,
yeah,
like lots and
Yeah.
everything is in Vietnam.
yeah. I mean, it's similar with Everfree, right? Like the U.S.
Yeah.
registration is like for fundraising.
Yeah. But there are for fundraising it's like a lot.
Mm-hmm.
Because it's Australia, it's New Zealand. I think they register so many. Because I was really like curious then about how big is their like operations?
Yeah.
Because they are CBD, like it's like
Yeah.
Blue Foundation.
Yeah.
In different countries.
Yeah,
So everything else is like fundraising.
yeah.
They establish it that way. The one from the Dragon area that we're talking about, we're like Fui, she seems so pleasant and nice.
We have an hour. I want to do her presentation. Gotta slow down.
Yeah, we have.
Yeah,
Is this the like
I think I do. 30, maybe.
some of the presentations they end at 40
Yeah,
and they did like this. Oh, they just have very little time for
yeah,
Q&A.
yeah.
So we will slow down. You know what the problem is with? No problem, but there are the constraints with Japan.
Not really, like, they haven't collected as much data, but it wasn't
They don't have like constraints.
Not really. Like, I mean, I think we want to understand if it's because the tool's not working for them, or if it's like they have other things, you know. Because if it's want to be able to make adjustments. So
So it's more like
as far as we know, but
hi.
hello.
It's early. 10 minutes.
I've noticed people are very on time at this conference.
Like 2 minutes you're late, like you were late.
Yeah.
Right?
Yeah.
You were really late.
I arrived for the dinner last night at the start time, and I thought people would start to get there at the start time, but I was the last one there. Everybody was like waiting to go.
Oh my god.
Last night I went to buy water. I went to buy water, and I was gonna get 4 big things, and then I went to pay for it, and I tried to like pay cash, and I had to cover it cash because I changed money in Korea, and I asked for Indonesian, but she gave me Korean, and I did not know this. And the woman was like, "We only accept Indonesian currency," and I was like, "Oh, okay." And so then I went to pay with a card, but to meet the minimum charge for card, I had to buy 8.
Same. You got 8. That's so funny. You didn't realize like it's Korean.
When she said that, I was like, what? Oh.
Oh, that's Korean.
Because I went to the currency exchange and I was like, do you have Indonesian currency? And she said yes, and I was like, great.
That's so funny. So now you have to like, change the money
I
or
mean,
wait until you go
I
to
have a
Korea.
6-hour layover,
Okay.
so I'm like, I guess I'll gotta spend the money.
I know there's something with the duty free here.
Yeah.
Oh, that's funny.
Are you ready?
Hopefully.
Let's find out.
Somewhat.
We've both given this presentation, but not together.
Yeah. But it's different each time.
Yeah.
Are you liking the conference this far?
It's been good. Yeah. How about you?
I think like also the networking part. There are conferences that are less there are less opportunities because of all the dinners that are organizing and the breaks. And
Yeah. And people are very open. It seems like everybody wants to greet everybody.
Yeah, and like you know when you go to some conferences that you don't know many people and you end up like not knowing who to talk and no one is so friendly that like
Yeah.
you don't know the next space to approach.
Yeah.
Especially like academic conferences can be a bit of like
Yeah.
you're not in my group.
You're an outsider.
When I went to International Studies Association this year, I didn't know that it was so big. Because most of the academic conferences that I go to are like this size.
Yeah, I think that one is exceptional.
Yeah. And so I walked into the lobby and it was just full of people who were clearly at the conference. I was just stunned.
Like it's overwhelming.
I didn't really meet anybody at the conference.
Yeah.
Just,
Hard.
Yeah.
Feel a bit more. Or also once I went to the conference, it wasn't so big, but it was like not targeted to junior or like back then I was finishing the PhD, not targeted to junior researchers or people in the early stage of their careers. It was like a lot of top professors knowing each other for 20 years and like hanging out in groups and they're like you're already a bit shy because it's the beginning.
Yeah.
So I remember in that conference I was so afraid of the coffee break. Oh my god, when we're going to coffee. Can we skip them?
That's so funny.
Hello.
There is at the moment you're gonna be like you're gonna be in front. Like you're gonna be in front. With your camera on, it looks so professional. I feel like you on a phone. It's
I
like
was told by the higher ups I should bring
Krisha is the higher up. Krisha the higher up.
And so, did you happen to take a couple of pictures?
I did, yeah. I'll send them to you. Yeah. My camera's not very good, but
just
yeah.
Listen, you can't remember. Do you have WhatsApp?
I do.
Beto daw i-test kung come on.
Nag-asa ka daw.
Asa ba ka diha?
Yung answer.
Mo ano gid siya?
Ray mo flash.
Di ko auto kay mo ano gid siya?
Ayun, no flash, Ray, no flash.
Oh, no, I put it in auto. So it's you know it's assured that it's nice, but it has a flash. So I'm changing the settings.
Right, Angela has a specific angle she's wanting.
Have you decided, Angela?
I have not. It will be luck of the draw.
Because I noticed one of the pictures that Krisha uploaded for our RGS training back, like, I was like, can you find us food? My mouth is closed.
Perfect. Yes. Yeah.
Yeah.
I'll have any more video right now. Instructions.
Do you want like behind the scenes?
Instructions on Krisha. All video. Oh, sorry. It's okay for us.
You want the Sino? Kasi nagpo-practice ako.
Pwede ko rin practice.
Well, seriously. Are you also a teacher?
I was given a job, so I'm gonna take pictures.
Hi, I'm
Oh, you haven't seen me? Good for you.
How are you doing? I'm fine. Yeah. It's the first time I'm sitting through this visit.
Okay.
In outside.
Yes.
Everything.
Yes.
That's
Give us one job. That's all I have this whole time. Are we gonna go sit here? That's probably better.
Here so that we can take nice pictures.
Hey.
The same otter.
Huh?
I bought the same otter, but not exactly like that, but
Yeah.
the same blue.
Yeah. The blue is so pretty.
Yeah, I know. Let me wear it.
Look at smile at me again. Wait, scoot over so I can get the board.
Yeah.
It's all about photo ops.
Okay.
You better Phil. I'm such a bad. What's her name? Asked me to do it too. Yes. So that's.
Oh, that's pretty good.
Yeah, better than
My friend Zona, ever from Philippines. I've heard all about you.
You've had all of us.
So good, like I heard about you.
Oh, it's so nice. I'm so happy to see you at this hotel and the sun is present.
So I want to go to her and introduce myself. Okay, let's start the dummy.
Alright everyone, thank you for joining us this afternoon for this session on empowering survivor input into Aftercare. We're really glad to connect with you all. I'm Angela Robinson. I'm a researcher at the University of California, Irvine.
I'm Joy Elishard, Coaching Director of Every Philippines, and we're implementing the Freedom Life Map in our context.
So our organizations have been collaborating for the past few years on the development of the Freedom Life Map tool, but there are a lot of partners in this work, so I want to acknowledge some of them up front, starting with the GLC, which has helped to facilitate and support the global learning piece of this project, along with our innovation partners who are piloting the tool in different contexts. So our innovation partners include Shopdai in Cambodia, our friends from Azadi who are here from Kenya, Vida, Project Suma, and Orangewood Foundation, as well as Evergreen signature sites in the Philippines and Uganda. And also want to acknowledge the contributions of the lived experience experts who were part of developing the tool and validating the indicators. Many of them have opted to be recognized by name or by a pseudonym for their contributions to the work, which were really important in developing Freedom Life Map. So I want to thank all of them as well. And just to really kind of put some geographic context around what will be the data that we'll be sharing out today. So we have pilot sites in the
Americas, in the United States, Bolivia, and Mexico, in Africa, in Uganda and Kenya, and then in Asia, we'll really be focusing a lot of the presentation today on that data from the Philippines and Cambodia. And again, focusing on some of those global insights and regional insights through the learning network that we have facilitated by the GLC. So as all of you know, about 50 million people are currently victims of trafficking and exploitation. And according to the Trafficking in Persons report, less than 1% of those victims are ever identified or able to receive the care and services that they need to remain free from exploitation. And we see a lot of that as stemming from some key data challenges. We know that good data and evidence really drive effective programming as well as allocation of resources. So through Freedom Life Map, we sought to tackle some of those big data challenges that we see in the anti-trafficking sector. So some of those are around the challenges that organizations face in measuring true impact. So it's easy for organizations to measure activities like the number of nights that somebody stays in a shelter setting or the number of counseling sessions that people take part in, but harder to measure some of the outcomes that really matter for survivors and how programming really impacts their long-term well-being and freedom from exploitation. A big theme of the conference has been the exclusion of survivors' voices and input, and Aftercare is no exception. So we really sought to bring survivors' voices to the forefront in shaping the care that they receive from aftercare organizations. In the literature, there's also a lack of evidence. So as of 2019, a systematic review of the literature found that there were only 6 published quantitative evaluations of aftercare programs. So that makes it really hard for organizations to find out what other organizations are doing that's working really well that could be adapted or expanded to new contexts. And then funding and policy have often had a narrow or donor-driven focus, and sometimes that has resulted in focusing on specific policy priorities or funder priorities that kind of overlook survivors' multidimensional needs. So through Freedom Life Map, we sought to address some of these challenges, and we see a lot of those things as driving high rates of re-trafficking. So the Freedom Life Map conceptualizes, thank you. The Freedom Life Map sees survivor well-being through 6 dimensions that were identified as part of the research conducted with lived experience experts around the world. So the indicators in Freedom Life Map are organized into these 6 dimensions that include health and basic needs, rights and safety, housing, infrastructure, and access, education, employment, and finances, community and connection, and mental and emotional well-being. And Freedom Life Map seeks to make change at 3 levels. So in the center of the model, and most importantly, is the individual survivor's well-being. So the tool seeks to improve the aftercare that individual survivors need and tailor their pathways forward to best meet their existing strengths and their priorities. It also seeks to improve the work of organizations by understanding what's working well and what the gaps in services are to develop more effective programming to meet the needs of participants in your programs. And then zooming out from there globally, it can help us identify trends and patterns in the strengths that survivors bring to the table, as well as the needs and priorities that they have and how we can all advocate for policies and funding to address them. And so we'll talk through each of those 3 levels in more detail, and I'll hand it over to Jonah to start with survivor care.
Yay! So, good afternoon everyone. So I'm going to be discussing today about how the use of the Freedom Life Map actually helps the survivors on an individual level. So why do you actually use the Freedom Life Map? You're going to go through this thing first. So just getting the primary information about the participant. There's first name here, there's last name, but we actually code the clients. So real names are not reflected in the tool or in the app that we're using. And then of course, we check on whether this basic information they are coming from community-based or if they are coming from shelters from our partner organizations. Then getting through the usual age, physical status, and the basic information that we actually wanted to get to know
about the survivor that you're working with. So after this part, we get to the interesting part of the freedom lineup according to the clients that you're working with. So they would see colors in green, yellow, and red. So essentially this example here you'll see is from the first dimension in health and sustenance, specifically on physical health. So it tries to measure if they have access to medical care. So if the clients actually feel that they have access to it, so they would choose green. So you can see the stoplight theme here. But if they feel like it's a vulnerability for them, so they would choose red. But if they feel like they are somewhere in between, they would choose yellow. So they go through all of these process for the rest of the indicators in the 6 dimensions that Angela showed earlier. So that's the first part on the survivor side. But the best part for them, this is how they actually express it, is that when they see the life map. So essentially, after going through the indicators for all those 6 dimensions, they would see the summary of their responses. So this is actually a guided practice where the case managers decide the client that they're working with. So they would see a summary of where they are according to the indicators in the dimensions. So from that, they would then show or they would then pick the areas that they would want to prioritize. So for example, in this case, they would want to prioritize income because it's a red for them. So in the map, you would see what are, summary of the reds, the summary of the greens, the areas that they want to work on. So in this example, the client wanted to focus on income as a priority. So they go through this 3 questions that actually for us helps a lot in the planning for interventions for the clients that we're working with. So we identify the barriers, why is that a concern for the client that we're working with, and then we try to think about, so what are the things that we could actually do to help them address those barriers, and for how long a time can we actually see progress in that specific priority. So we ask the client if in the next 6 months, what could be a very realistic number of priorities for you. For others, it is just 1, 2. For others, they would say 3. So in this example, the client actually prioritized 3 areas in the next 6 months from the time of the assessment. So the client then would see the summary of what she chose. It's here, it's income, savings, and education skills for employment. And the client would then see the summary of the barriers that she actually wrote in the map, in the tool. And then what are the things that they could do to address that, and then the time. So this actually helps the client, but us as well, as service provider, to actually narrow our focus on the interventions that's possible for them to access. So essentially, on an individual side, this is a feedback that we got from a survivor in Uganda who said that what this tool did in 30 minutes would actually have taken a case manager years to understand the outcome. So that's the part for how the tool is actually used on an individual level. Now we go to how is it actually used for us as organizations. What is actually the value that we get out from using the Freedom Life Map as an organization? So this is the average assessment of the numbers of participants that have gone through the Freedom Life Map for the Philippines. So we are able to see in the tool, in the overview, about the percentage of greens, the yellows, and the red for all of those that actually completed the Freedom Life Map. Then you would further see the assessment. This is the first survey, the time one assessment that you have conducted with the clients that you're working with. So you're able to see the summary of the progress of all of the clients that you have worked with according to the dimensions. So in our context, or at least for the clients that we're working with, we see here that most greens are in the areas of rights and safety, while the fewest greens is in the area of education, employment, and finances. So it tells us about what other things they actually think about relative to that area or interventions. So here on the left side, right side for you, you would see the pin, the 134. This is the number that made it the most priority for the clients that we're working with. And then not only can we actually see the summary according to dimensions, because it's valuable for us to know on a very detailed level what is a specific indicator that they're actually saying that they're having most transact, but most especially what's the fewest screens according to indicator. So for the Philippines data, so these are the top 5 most screens. So essentially with the clients that we are working with, they have the identity documents for the most of them, rights and protection, access to clean water, literacy and numeracy, and then freedom from sexual exploitation. Those are the very specific indicators that they have recorded most news on. But this is also the picture that is fewest in greens for those that we are working with. So it's always, we weren't really surprised with the results because income, that's number 1 for them, which is because we audit, right? And then phone and internet in our case, because the access to it for the clients that we're working with as they go, it's mostly internet and data that they have to go through for education and looking for work. That's also a major concern for them. And then savings, and then healthy lifestyle, and then healthy teeth and eyesight. So these are the fewest screens for those that have completed the Freedom Life Map in our pool. So from seeing the data, here are the information that we are actually getting relative to the top barrier to savings for the clients that we are working with. So there's limited income, the participant supports family members, they're actually in schools, they cannot have savings because they cannot find income, and then they have debts, and then there's lack of money management or skills. And further, from the results of doing the Freedom Life Map, these are the top pathways towards saving that the clients have identified. So it's about number 1, the participant identifying a specific savings strategy, better money management behavior, better money management relative to knowledge and skills, and there's the generating more income, and then finding a job or a better job. For us, because we are mainly focusing in the Philippines on economic empowerment services, really for tracks in education, employment, and entrepreneurship, it actually allows us to reflect more relative to, so how should a proper financial literacy program look like for us out from the data that we're getting from the Freedom Life Map. We're also trying to figure, so what then would be a good entrepreneurship program? Because while we are already doing these services, maybe there's more that we could figure out from the results of the Freedom Life Map that the clients are actually informing us on. So here, because we have done already the time 2 assessment, so we have done the type 1 assessment, the first one we call the baseline, and then 6 months after, we also do the Freedom Life Map assessment. And this is a picture of how it looks like. So for our team, this is like a chart where it inspires everyone, because it tells us that there's progress relative to interventions that they're actually being provided on that they're seeking. So it gives us hope that we are seeing bits of progress from the last 6 months that we are actually working with them. So this is like a thought we got from our partner in Cambodia that we resonate with the most, and I think for all of us here, that says the resources available in the community are stretching thin. So what this actually progresses our work to make it more responsive to the needs of the clients that we're working with, because we always do not have much. We always have to make do with what's in front of us and prioritize how we actually allocate resources. So while the Freedom Life Map on an organizational level informs how we allocate resources, we actually use it as a supervision tool for our team. Because there you actually see information and progress of each of the social workers or case managers. So we would actually know through the Freedom Life Map about who are those that who needed more support on. So we are using also the tool to actually provide the support needed for the team that are actually doing direct work with the clients. Outside of that, because it's very structured, so it helps a lot in actually streamlining and meetings and following throughs with the team that we have in the Philippines. So yeah, I'll hand over to Angela.
So now I'm going to talk a little bit about what we are learning from the data when we compare across organizations. So Jonah's team is on the cusp of launching the Freedom Life Map Southeast Asia Network, which includes 8 organizations within the Philippines and also an expansion into Vietnam in partnership with Blue Dragon. And some of the things that we gained from the network are the ability to leverage Freedom Life Map data to learn and collaborate and improve care for survivors. So for organizations within the Philippines who are sharing data from the tool, it helps them to facilitate better referrals and avoid duplication of services. So they can see what survivors are already receiving from one organization, what they've prioritized, and where they might refer people to provide a better community of support within organizations that are all working toward the same goals. And then using the data that comes back, it also helps organizations in the network to collectively advocate for funding that best meets the needs of survivors, things that people are prioritizing that might be gaps in the services that are available, and to advocate for policy changes as well. And then zooming out beyond the network within the Philippines, we're also making comparisons across countries and seeing a lot of similarities that pop up, as well as some nuances across different contexts. So this is the data coming out of Chok Dai's program in Cambodia. And so you can see their overall pattern of greens, yellows, and reds. We see some similarities popping out right away in terms of areas with the greatest strengths, which includes rights and safety, and then greatest vulnerabilities in the area of education, employment, and finances. And so we're able to make these comparisons explicitly across the different dimensions from different countries' data. So here we've ranked the different dimensions from area of greatest strength to area of greatest vulnerability within each country. We see that rights and safety is among the top strengths within both contexts, and so is community and connection. On the flip side, when we look at vulnerabilities, we see similarities there as well. So education, employment, and finances is the #1 vulnerability across both contexts, followed by health and basic needs. And we're also making those comparisons not just within the Asia region, but also globally. So this is a quote from Jonah about the impact of the network and learning across organizations in the global network. So she shared, in our daily work, people from Bolivia will never talk to people from the Philippines, but the data show that so many of our challenges and solutions are the same. And we do really see that reflected in the data. So again, we've got the dimensions ranked here from most strengths to most vulnerabilities. We see rights and safety is one of the top areas of strength for survivors across all of the 7 countries where the tool is being used. And that really reflects the shared commitment that all of the organizations who are using the tool have to safety planning and ensuring survivors are free from exploitation within their programs. We also look at the specific indicators where participants are reporting the most strengths, and we see that freedom from sexual exploitation is one of the top 5 strengths within those specific indicators across most of the contexts as well. Again, reflecting the importance that the organizations are placing on prioritizing that from the very beginning of a survivor's time in their program. And then looking at vulnerabilities, we see that education, employment, and finances is the #1 area of vulnerability across almost all of the contexts where we're working. And looking at the specific indicators, this is the indicators that are most prioritized across the different contexts, so the top 5. So we see income is prioritized within the top 5 in 5 of the countries. Medical care is within the top 5 for many of them as well. And then in 4 of the contexts, we see savings as the #1 priority. And Jonah really honed in on that and how they're using that data within their program to understand the specific challenges and barriers that people face. And so we're analyzing the open-ended data that comes in from the tool to understand where the challenges and barriers are similar across contexts, where they might be different, and how we can identify solutions that might work across those different areas. So
one of our next steps is to put together working groups on key topics, one of those being savings, since it is the #1 priority in several of the contexts, and I think within the top 10 in almost all of them. So we're looking to put together a working group to see what programming is already being used in the anti-trafficking sector that might be effective, as well as what interventions are used outside of the anti-trafficking sector in perhaps the poverty alleviation sector and related fields that we can learn from, and identify what's effective within anti-trafficking work and grow that within our organizations. And I'll turn it over to Joanna.
So, if you're interested to know more about the Freedom Life Map and for just to share with you how it works for other organizations who have implemented the tool already. So, we guide the organization in adopting the tool to their specific context. So, in the Philippines, we have adopted the tool, or it was actually a tedious process, but it was very helpful. We are doing the same as we are talking this time with the Vietnam team. So that's how we actually try to start with the Freedom Life Map implementation. We start with the adaptation from the global indicators. And of course, we provide training on technology, on the methodology and the best practices. After that, the survivors are then ready to do the assessment with the facilitator. As mentioned earlier, the assessment is done by the client, but then it's always guided. The case manager is around helping the client think through with the indicators in front of them. And then they are able to set goals and priorities from what was shown earlier on the survivor side, how they're going to go through that. And then after working on solutions, we actually come back and then do another set of assessments 6 months after. That's for our end, for our context, we do it every 6 months. To see actually progress on the priorities and at least on the different indicators, give about enough time for them. And then they again begin to select new priorities if there are still more. But also the indicator as well, we're actually using it to identify if it's the time to actually close client cases. So while there are other things specifically that we mentioned about this is how Freedom Life Map data is being used, but in our end, it became also a case management tool. It became identifying if ready for client closing or not. So yeah, the organization then are able to track outcomes and impact as shown earlier. Once they have a number of assessments already, they're able to see how those in different dimensions, how it actually progresses for the clients that they're working with. So just showing in here. We are doing the waitlist process with Binta, our colleague, who is actually leading that part of the work in the Freedom Life Map expansion. So I think that ends our presentation this afternoon. We welcome thoughts, comments, and questions.
I don't have a question because I've been too involved in this. I'm just really excited to finally see the presentation. I think one of the things that I'll say that probably I didn't see in the presentation is that when those of us who were involved in really thinking about the questions and everything, we had such a huge discussion on what protection means for survivors and what protection means for service providers. There's an assumption that it's the same thing, and that the conversation during the developing actually got us to a place where it was like, it doesn't necessarily mean the same thing. So the questions actually highlight some of the things that survivors actually want questioned and practitioners never questioned. I think one of the most interesting things that happened, which was exciting for me, was this whole idea of dreaming and imagination and thinking about the future and beauty as part of well-being, which is not something that I think many people think about when they're designing protection programs. My hope is that actually this just completely blows open how we do protection, because we really need to undo some of the really paternalistic ways in which we work with survivors, and I really like the way this was done. Like it was really done from a place of strength, thinking about protection from a place of strength rather than from a place of pity. Yeah.
Thank you, Sophie. I will say one of the pieces of feedback that we get the most when survivors look at their life map is that they have more greens than they expected, or more greens and yellows than they expected, and that's really hope-inducing and powerful for people to see their strengths reflected back at them and have the case manager say, we see these good things in you and we recognize them.
Okay, good afternoon everyone. My name is Jamran from Chamnai Tourism, Cambodia. We also apply the Freedom Life Map with our survivor as well. Until now, it is in the testing process. We did more than 10 survivors already. Personally, I'm not clear yet about the result of the Freedom Life Map. For example, we have red, yellow, and green. Yes. So for the survivor that show that they are in the red light result, this how do we deal with the situation? It means that we need to develop the new program for the red result survivor, or we respond to them based on our project, or the survivor themselves, they deal with the situation by their own ways.
One part that we actually do it, because we're both like implementers on the ground, is that an exercise that's very important actually is we firstly do the resource mapping, because we acknowledge we cannot provide everything that the client would say that would become their priority, but we could help them think through and access the right support. When that's how we do it in the Philippines, we resource map first, because we always say it's never ethical to ask for something and express a need, and then we cannot actually tell them anything back on how to answer those needs that they have expressed. So that's what we do. We resource map first. We really identify. We don't leave them on their own. That's why they have a case manager with them in going through. And the case manager would have to be very familiar with what are the maps around, the resources around the community, so that when that need arises, she is able to express and inform them as to how to get access to those. So that's how we do it in the Philippines.
I have a lot of questions. Okay, so practically timelines when we're talking about from crisis call all the way to, after crisis, a little bit more stable. Typically, when does this freedom map come in? Because I know typically crisis call, your safety planning, you're trying to get them out of that. But for y'all, what did that look like?
Well, we definitely don't.
Honestly, you're not like, oh, Barbara, you just came out, let's do this.
Yes. So because for our end, it depends on how the clients actually responds. If they are in a space where they are ready to think about Freedom Life Map, like planning and assessing, then that becomes the time. For others, upon like crisis, and the focus needs to be on the direct intervention right there and then, that's going to be the focus. Freedom Life Map will have to wait until they're in the right space to actually think through about the indicators or where they are across those indicators.
I have a question for you.
Sorry, yes.
Sorry, like, why would it be different? Like, why wouldn't this work at any different points?
I think it could. It just, for crisis, when we talk about crisis for our organization, it's like they just come out. Sorry, I'm thinking in Bahasa. I'm thinking in a different language. They just come out of trafficking, whether that's a recovery by the police, like they're just coming out and then we're doing safety planning and we're meeting those immediate needs, versus like, okay, now they're maybe 72 hours after that initial coming out of that initial recovery, then we can start thinking about this. And so we have like safety planning
parts that we do that are very kind of similar to this. So like, do you feel safe? You know, physically. Let's talk about those, but it's a little bit different. And so,
I'm just saying that because like even in most crises, we make so many assumptions about what people need, and again, what I've seen is most of the crisis planning, because I feel like for me the idea is any sort of solution we take needs to be participatory.
Yeah.
And I find that most of especially when people talk about crisis, most of the time there's just an assumption of what people need. So that's why I'm saying that, like, I would look at this and still be able to, because you're going to ask someone these questions anyway, right? So why not still allow them to just do it themselves? If you're going to, I feel like for me it's more of a question of how would you administer it in a crisis situation, as opposed to is it needed? Because I definitely think an approach that is participatory, completely controlled by the person who's been impacted, is important, rather than what I've generally seen, which is most of us have protocols that we follow that are completely based on assumptions that we've had over a long period of time.
Yeah. I guess to follow up with that, then has Everfree in Philippines, we don't have crisis calls in response. Because for us, our safety planning is very participatory, but they're not typically in the space to think about this and taking action. And normally, so it's like the safety planning looks different. But y'all, what does that practically look like?
In cases of suicidality, definitely, I mean, clients come in, you're in a session with them. When disclosure happens about, certain things, you actually focus on the disclosure first. If they're not in the right, when we actually stop or pause, we do it. Because when, they come in and, suicidality and then even the partner violence, those things we address first with safety planning and everything. And then we come back with these things when we ask them if they're ready, to complete it or not. But that's usual, actual practice of when crisis happens. Because it can happen all the time when you are just with your counselor or your case manager, disclosures happen. So we focus on the disclosure and do safety planning or whatever we need to do during that situation.
Wow. How's your experiences with children victims? In the context of safe house, shelter.
So it's been used with ages 13 and up, but not with young. We haven't piloted it with younger children yet. I think the assessment process has been working well. The goal setting has been more challenging for younger participants.
And then it's also been helpful in the safe house setting?
So the programs that we're piloting it with have different formats, but some of them do have safe houses.
Is there a cost?
Yeah, how much does it cost?
There's a wait list, but then is there a cost? Or what does that process of we're interested in this, sign up for the wait list, what does that look like?
So for anybody who's watching virtually, the question was about if there's a cost and what the wait list process looks like. So right now the pilot partners are funded by grant funding from the UK Home Office Modern Slavery Innovation Fund, and then from a funder, Sandy Valley Foundation, supporting the work in the US. It's currently a resource generation phase of figuring out what the funding structure will look like long term and how that can be rolled out. So yes, we're eager to get it to more organizations, but thinking through what the funding structure looks like.
Okay, thank you. I have two more questions. The first one, I would like to know the best practice in Philippines. Like, how long does it take for one survivor to complete all the forms, let's say on the platform or the Freedom Life tool? How long for one survivor? And question number two is how you make sure or how you provide a safe environment to the survivor in order to respond or to click on the tool correctly, because if they click like it's not honestly from inside, it might be error in data analysis. So in this case, how the environment or how your strategy to make sure that the survivor really click on the lights based on their real situation on this.
The first question is easy to answer. So roughly for those that you're working with, the ideal 30, but like we're seeing for time 2, it gets to 30 minutes. But for time 1, the first one, it gets to 40 to 1 hour. For the environment part, we actually do it in, we have a counseling group. So essentially, it's a safe environment where they are free to actually press the responses according to. But I guess the question is more on how, accurately, like, are they actually accurately measuring their progress? So what if, I guess this question actually comes up very regularly with those that we're working with. What if the case manager thinks that's not the right color for the survivor, and the survivor thinks this is the color for her? So this is definitely what the client thinks. Our task is to actually facilitate and to ask the question to understand more. But ultimately, it's the client's view of what color she is in across this indicator. So accurately, so it's like the client's perspective relative to that. We may agree, we may not agree, but we feel like it's a relationship between the case manager and the client that has to be worked on, so that they could come from a place of like honesty, those types of things. But definitely what the client thinks is what should be in the tool.
And also just to respond to his question, because our approach is a bit different, we mainly work with survivors who have gone through the initial initial program. So ours is focused mainly on long-term reintegration, so Aftercare. And what we do to ensure that whatever is being put in the tool is accurate, we normally have sessions with Azadi members or survivor leaders within Azadi. So we are all in one room, and then there is sort of like a facilitator who is going through the questions, who first explains about the tool, about what red, green, yellow means, and then there's a facilitator in the room to take people through. Everyone has their own device. So she's going through the questions and explaining what they mean, and then someone then now selects their answer. So I think that handles the aspect of maybe someone doing it from home and misunderstanding. So everyone in the room has the same understanding of every question. Yeah.
My question is more on sustainability, and this is more because those of us who've been in this field, tech solutions have been introduced, we've tried them, and then something happens, and then, essentially we're back to scratch, right? I'm just putting this out, and it can be really wary. For me, it's, to be honest, as a protection practitioner, it's quite wary, because there have been several solutions that have been put out there, and then essentially the inability to fund them through has been an issue. And now you have all this data that was in this system, and now you don't know what to do with it, because essentially the people who are administering that system no longer have funding to be able to continue through. My question is, what is the plan of, because we have to think about it, it can happen worst case scenario, Everfree does not have funding, what happens to the data, what happens to the organizations that are already being onboarded, because I think it would be, yeah, I wouldn't, it would be, yeah. Yeah.
Yeah, it's a great question. So it is a big investment to create a platform for it. I think there are definitely options for getting the data off of it, and it's easy to export the data into reports and dashboards and things like that. But the sustainability of making the tool available on an ongoing basis is really important. I think the cost of developing it is significantly higher than the cost of maintaining it, but it's still a critical question to think about. So, yeah, I think, but yeah, that process is in the planning phases.
Sorry guys. No, I think, and definitely as those of us who are involved from the beginning, I genuinely think that most tech solutions come up, like that's usually like the last thing that people think about. I genuinely think that if this is a community tool, let's bring it to the community. Let's really think about sustainability and what it can take for all of us to own it and all of us to be able to, so that if there's a commitment, it's a buy-in that all of us are in. And if anybody leaves, because to be fair, even if that data is given to a grassroots organization in forms and everything, they wouldn't be able to use it. What they need is the platform, if we are being real.
Thank you so much for the wonderful material you have presented. Basically, the material is in English, and so I just wonder if this is also translated to other languages.
In the Philippines, it is in 3 languages. It's most common, Tagalog, English, and Cebuano. And then other countries, like they have the Cambodian,
Cambodia is just in Khmer, but it's translated into the local languages used by whichever organizations are using the tool.
So what has the contextualization process look like when you enter like a new country? What does that typically look like?
Yeah, so there's a process of going through each indicator one by one to review it, to make sure that the concepts that are in that indicator reflect the main challenges in that context. Do the examples seem relevant in that context? Is the wording appropriate for the context? So I can give an example. One of the indicators is about basic housing. Does your housing have all the kind of basic things that you need? And what that looks like in Cambodia, it looks quite different than what that looks like in Kenya, looks different than what that looks like in the United States. So the description of what basic housing requires is different in those contexts. So we walk through each indicator in turn to make sure that it's contextually appropriate for the context.
Can you combine these tools with the case management database? Like example, organization now doing trial of the online database called Oscar. I don't know if you've ever heard about that. That's from CIF in Cambodia. Children and Families. It's open source of case management and data record keeping. So can we like use both that and then also this rhythm alignment? It's like integrated, or it's like
I guess that's the best way to put it.
Yeah, or maybe like if you use both tools because it's not like completely different. But thank you.
Yeah, so there aren't any current integrations. There will be basic case management features within the platform, but many organizations are already using something that works well for them. I know Chaptai, you're using Oscar as well. And I'm curious if you know if any of that data is kind of included in your case management platform in Oscar, or if it's just separate. For Chaptai.
Okay. I don't know enough about technology to know exactly specifically.
Yeah, so I think the whole integration, I'm familiar with the supplier, like how their experience has been. But for us, we don't have, we are waiting for the whole Via Life Hub to become like a case management tool for phase 2. Because at the moment, it's still a separate thing for us, but we are doing manual integration, which is very tasking. So that's why our hope is that will become, because at the moment they're already using it as a case management tool, like information, as supervisory tool, like lots of other things that you use it for. But yeah, it's mindful for us.
Okay, anyone else have any other questions? I can go, but
you have 10 minutes left.
Another do I need this? Sorry.
Yeah, I'm fine.
Another practical tool, so say you're in an area that has poor service or signal, because I'm assuming it's like an iPad, laptop, Wi-Fi, all that. Is there an offline version, paper version that then they can re-upload? That's all possible.
Yes.
You just gotta check.
Yes, there's an offline version.
You never know.
Yes, those types of emails are what we hear each time, like a person like saying, "This is how we're gonna do it." And it's just like get it done.
Worst comes worst, if servers go down.
Yeah, so there is.
Okay.
Okay, so I think that's it.
Yeah.
So.
Thank you everyone for being here. We'll be here if you have any questions, and appreciate you being in attendance and discussing with us.
I'm telling
I've seen this. I've been through this.
This woman, we had asked me part of
Ask Jonah and answer the hardest question.
These are the friends I have. Do I need enemies?
Why need enemies? If you have both.
She's doing a good job being both. No, but the thing for me.
But what you're saying, I think you're spot on, but it's also cool at this stage of like you're building it. Like you don't want it to be a barrier to building and creating, right?
I don't think it should be a barrier to building and creating. I think there should be the team that is the team that is. It needs to be thought about. The team that is building and creating needs to be separate from the team that is thinking about its sustainability. So I think
it is because it's the board thinking about that.
There needs to be a wing that is thinking about sustainability completely, and the team that is creating can continue improving, and their main focus is thinking about like what are the people saying about the experience using the tool, all these different things. And honestly, I don't think that the people thinking about sustainability needs to be the board. I think it needs to be expanded, especially in other organizations are using it. Is it possible for other people for that thing to be done with the people actually also
Experiencing it. Yeah.
Like, is it possible to expand it? Because if this is a full space, the ownership has to start now, or it's not going to work. Like that sustainability, it's not going to work. And I'm saying this because I've been through this thing for a while. If there's no ownership from the beginning during closure, you're consistently going to be trying to convince donors that they should pay for it.
Yes.
But if that is built right now, then these organizations will budget for it, will do all these different things. So it will be in the system. So for me, I just don't. The team that is designing and working on it should continue doing that. But then that whole other piece.
Makes me wonder. So, does the board need to actually hear from those stakeholders to better understand their responsibility as long as well for the sustainability?
That's a question for everyone. I feel like, but there's so much good work that could actually be done in partnership and movement building as a result of the tool that could make people have the buy-in, and that work needs to be done, and the tool won't do that work. That's a different set of work.
That's a different.
It's a different set of work, I think. It's a completely different set of work. And so for me, and it's the fight that I also had with this year, and I said the groundwork that needed to be done before or in parallel or for it, so that even if anything happened, like people would still be able to continue, people would still be able to pay for the platform because they need it.
Yeah,
they need it, and this needs to be part of it. It also needs to be seen as part of the protection system, right? A cost within the protection system, right? Because if it's seen as, and I think I told Kelsey this, if it's seen as a tech tool, there's a tendency of people not prioritizing it because everyone is focusing on taking care of customers, right? So it gets pushed back and it gets pushed back. But if it's seen as a core part of protection, a core part of standards, a core part of being trauma-informed, participated. So even when I talk about it is, do you want to be participated? Then this is about
this
right?
is the tool.
This is about, so also a shift in how we talk about it, because then it's not optional.
Yeah.
So I don't know, but those are just my criticisms. But I think just an expansion in the thought, if that thought around sustainability was not, I would feel more comfortable if that thought around sustainability wasn't being done by everyone. Because what people will not tell you, and some of us will tell you, is that right now it will continue being an ever-free tool. And if that's what if you want it to crash very easily, it's for it to continue being an ever-free tool, as opposed to a community tool. Like what every single person who's come with a tech tool has failed is like all the tech tools I've seen have been organizational tools. They've belonged to organizations. They've not belonged to the
But what could
movement.
that actually look like?
Right.
So I think they started well in that the creation and development. I mean the bones are there, right?
Yeah.
The creation and development was done by the community, right? The next, all the different levels need to be done with the same spirit, including the thought of sustainability.
Yeah, no, I'm just wanting to listen to the discussion of
Speaking
Jesus.
of,
Is it?
Oh, is that recording
I'm
us?
just like
Still?
all the bones.
Oh,
Face like
you were told the breakouts weren't live streaming.
yeah, it's live
it
stream.
was live stream, so like all of the conversations are
Yeah.
Sorry.
Because that's okay, didn't say anything.
No, we were told in the notes. We were told that live.
There's one breakout room that's not.
Breakout 4.
How long have we been
Is it still streaming? So long as you And this is just like the bad thing. This is the bad thing. All the time, the problem is that they have long term.
Tapi jika
Organizations that we roll down.
mampu
I am, so long as it's being rolled out, this friend just have the accuracy of competition and they go to
it's bingung sih karena aku bilang provinsi Lampung dan banyak orang di mana and you're like technically Sumatera Selatan tapi bukan provinsi Sumatera Selatan.
So parang hindi ka na kasi it's not just about needs Basi, so ngayon, parang actually, hindi tawag niya. Actually, tawag na siya. Actually, si Julian kasi tawag ni Bolet sa so yun, they start as a one by one. It's like that. Tapos, 6 months after, yeah.
Going down? Yes. Okay. Still live stream. Oh.
their passports that were stolen from them in the scam compounds. If we get that passport, we can send it to those wallet companies and they'll actually shut down those wallets. So there are ways in which we're using technology in order to try to prevent or stop what's happening. But I think as a whole, I want to explore the idea of going back to perhaps what we would have done in the 80s and 90s to prevent this, because that might be what the world needs.